Hi. My name is Jones Muna. Today, we look at personality disorders. Introduction. People vary in the ways that they view themselves and others, engage in relationships and cope with hardships. It is quite common for these characteristics to occasionally interfere with a person's ability to cope with life and may also lead to difficulties in social interactions. When these difficulties are extreme and persistent and when they lead to significant personal and/or social problems, they are described as personality disorders. Personality hypothesis was guided by psychoanalytic or Freudian ideas of the id, ego, and superego. Personality disorders may perhaps be defined as deeply rooted inflexible patterns of relating to others that are maladaptive and cause significant impairment in social and/or occupational functioning. Alwyn et al. 2006. Personality is the total constitution of an individual which include the body and the behavior. Personality, defined psychologically, is the set of enduring behavioral and mental traits that distinguish human beings. Hence, personality disorders are defined by experiences and behaviors that differ from societal norms and expectations. Those diagnosed with a personality disorder may experience difficulties in cognition, emotiveness, interpersonal functioning or control of impulses. In general, personality disorders are diagnosed in 40–60% of psychiatric patients, making them the most frequent of all psychiatric diagnoses. These behavioral patterns in personality disorders are typically associated with substantial disturbances in some behavioral tendencies of an individual, usually involving several areas of the personality, and are nearly always associated with considerable personal and social disruption. A person is classified as having a personality disorder if their abnormalities of behavior impair their social or occupational functioning. Additionally, personality disorders are inflexible and pervasive across many situations, due in large part to the fact that such behavior may be egosyntonic, i.e., the patterns are consistent with the ego integrity of the individual and are, therefore, perceived to be appropriate by that individual. This behavior can result in maladaptive coping skills, which may lead to personal problems that induce extreme anxiety, distress or depression. These patterns of behavior typically are recognized in adolescence and the beginning of adulthood and, in some unusual instances, childhood. Etiology. 1. Biological, genetic, and psychosocial factors during childhood and adolescence contribute to the development of personality disorders. 2. The prevalence of personality disorders in monozygotic twins is several times higher than in dizygotic twins. Types of personality disorders. 1. Paranoid personality disorder, characterized by a pattern of irrational suspicion, mistrust of others, interprets innocent actions to be negative, defensive. 2. Schizoid personality disorder, lacks of interest and avoids social relationships, restricted emotional expression, lacks humor, apathetic, enjoys solitary activities. 3. Antisocial personality disorder, disregard for and violation of the rights of others, lack of empathy, always in conflict with the law, starts engaging in sexual activities at a tender age, make irresponsible parents, unable to learn from past experiences, lies a lot. 4. Borderline personality disorder, pervasive pattern of instability in relationships, self-image, identity, behavior and effects often leading to self-harm and impulsivity. 5. Narcissistic personality disorder, a pervasive pattern of grandiosity, attention seekers, exhibitionists, always asks for favors. 6. Avoidant personality disorder, pervasive feelings of social inhibition and inadequacy, extreme sensitivity to negative evaluation. 7. Dependent personality disorder, pervasive psychological need to be cared for by other people. 8. Obsessive-compulsive personality disorder, rigid conformity to rule, perfectionists. Treatment. Personality disorders are generally very difficult to treat, especially since few patients are aware that they need help. The disorders tend to be chronic and lifelong. In general, pharmacologic treatment has limited usefulness and is based on individual exceptions except in treating coexisting symptoms of depression, anxiety, and the like. Psychotherapy and group therapy are usually the most helpful treatment modalities. Thanks for listening and support our channel by sharing our educative content.